counter. I picked it up and glanced at the name, Claire Bennett, my sister. For exactly 3 seconds, I didn't move. The hallway clock ticks loudly enough that you can hear every second. Tick, tick, tick. Then my feet started moving again. The chart looked like every trauma admission I had seen in the last 6 years. Name, age, blood type, mechanism of injury, female patient, 31 years old, severe internal bleeding. Her name was still there when I looked again. Dr. Hayes. The voice came from the other side of the desk. It was Maria Delgado, one of the triage nurses. She's already on the way to OR3. The team's waiting. I folded the chart and tucked it under my arm. I'm coming. For a moment, I considered stepping away. Technically, I could have declared a conflict of interest. Another surgeon could have taken the case. That would have been the safe option, the reasonable one. But abdominal hemorrhage doesn't wait while someone sorts out family history. So I pushed open the doors to operating room 3. The room was already prepared. Bright white lights, cold air, metal instruments arranged neatly on the tray. My team stood ready. Dr. Patel at anesthesia. Nurse Grant circulating. Ben at the instrument table. Chief surgeon in the room, Maria announced behind me. No one asked questions. After 6 years running trauma surgery, people learn not to waste time before an operation. I walked to the sink and began scrubbing my hands. 80 seconds, counting each one. Water running over my knuckles, between my fingers, under my nails. I pulled on the gloves, adjusted my mask, then stepped up to the operating table. It was the first time I had seen my sister in 5 years. Bruises covered part of her forehead and neck. The oxygen mask hid half her face. The heart monitor beside her bed beeped unevenly. Her blood pressure was still dropping. I forced myself to look at the facts. Not my sister, just the patient. Vitals on arrival? I asked. Dr. Patel answered without looking up. Blood pressure 84/50 when she came in. Now 78/48. Heart rate 118. Oxygen 91% with support. She paused briefly. Fast scan shows internal bleeding. Likely severe spleen injury. Blood transfusion already running. Good. All right, I said. Let's begin. The surgery lasted 2 hours and 40 minutes. There was a moment, about halfway through, when her blood pressure dropped suddenly. The monitor started beeping faster. The sharp warning sound that every surgeon learns to recognize even in their sleep. Pressure falling, Dr. Patel said. Ben already had the instrument in his hand before I asked for it. Nurse Grant started calling out numbers every 30 seconds. The room moved with the kind of quiet coordination that only comes from years of working together. My hands didn't shake, not because I was brave, because they had been trained not to. 10 years of surgical training teaches your body something important, how to separate what you feel from what you... And if you don't want to wait for part 2, you can watch the full story on my YouTube channel. Just tap share, then more, and click the YouTube link here on my profile, or search for the channel Cooper Reddit on YouTube.